Infertility is not just a woman's problem. Understanding the real causes, myths, hope, and healing for couples. Hello, my friend. Thank you for joining me today. Let us have a heart-to-heart talk about something that affects many families, but often stays in silence. I'm talking about infertility, the inability for a couple to have children, even after trying for a long time. Now, in many of our homes, when a couple doesn't have a child, all eyes turn to the woman. Isn't that true? People whisper. Some say, she's barren. Some mothers-in-law say, let our son find another wife. And many women suffer in silence, blamed for something that may not even be their fault. But here's something important. Infertility is not just a woman's issue. In fact, about 1 in 3 cases are due to the man. Another 1 in 2 come from the woman. And sometimes both partners may have challenges. So today, let's talk honestly. Let us understand what causes infertility in men and in women, in simple terms. And most importantly, what we can do about it. Are you ready? Let's begin. What is infertility? First, what exactly do we mean by infertility? Infertility means a couple has been trying to get pregnant for a year or more. Without success. That's it. It doesn't mean the person is useless. It doesn't mean God has abandoned them. And it certainly doesn't mean they should be shamed. Sometimes the cause is medical. Sometimes it's lifestyle. Sometimes it's even stress. And the truth is, in many cases, infertility can be treated. Let's now talk about the causes, starting with the man. Male infertility. Yes, men can be infertile too, and it's more common than most people think. Let's look at some of the causes. 1. Congenital problems from birth. Some men are born with problems in the shape or function of their penis. This can make it hard, or even impossible, to have proper sexual contact with their wife. In such cases, it's not about blame, it's about understanding and seeking medical help. 2. Low hormones, testosterone. Hormones are like messengers in the body. Men need a hormone called testosterone to produce healthy sperm. If a man has low testosterone, he may make fewer sperm, or the sperm may not be strong enough to cause pregnancy. 3. Infections. Certain diseases can damage the man's reproductive system. For example, if a man catches mumps as an adult, it can affect his testes, the organs that produce sperm. Diseases like tuberculosis, syphilis, and gonorrhea can cause serious damage too. Gonorrhea especially can block the tubes that carry sperm. That's why treating infections early and avoiding risky behavior is very important. 4. Diabetes. A man with diabetes may have trouble with erections, or what we call impotence. Without proper treatment, diabetes can damage nerves and blood flow. 5. Alcohol and smoking. Heavy drinking and smoking don't just harm the liver and lungs. They reduce hormone levels in men. This means fewer sperm or weak ones. So if a man wants to be a father, cutting down on alcohol and quitting tobacco is a good place to start. 6. Premature ejaculation or impotence. Some men may release semen too early during sex, or may not be able to have an erection. Many times this is due to stress, anxiety, or past trauma. The good news? With support and treatment, these issues can be improved. 7. Malnutrition or chronic illness. If the man is not eating well, or has been sick for a long time, his body may not produce healthy sperm. Even things like severe anemia can play a role. So good nutrition and rest matter too. Female infertility. Now, let's talk about the woman. Yes, women can also have challenges with fertility, but it's not always her fault. Let's go through the common causes. 1. Congenital problems from birth. Some women are born without a uterus or with ovaries that don't function properly. These are rare, but they do happen. Sometimes a woman never starts her period, or her periods are very light and painful. This may point to deeper issues. 2. Hormonal problems. A woman needs proper hormones to release an egg every month. That's called ovulation. If her hormones are out of balance, she may not ovulate, or the egg may not survive long enough to become a baby. 3. Infections and tubal blockage. This is one of the biggest causes of infertility in women. The fallopian tubes are tiny pathways where the sperm meets the egg. If they're blocked, pregnancy won't happen. Blockages often come from infections like gonorrhea or problems after unsafe abortions or childbirth. Sometimes women don't even know they had an infection until years later when they can't conceive. 4. Tumors like fibroids or polyps. Fibroids are non-cancerous growths in the womb. Sometimes they make it hard for a baby to attach in the womb or can lead to miscarriages. 5. Injuries or mutilation. Sadly, some women have had their genital area harmed through accidents or even cultural practices like female genital cutting. This can cause pain during sex or even prevent intercourse entirely. 6. Parasitic diseases and fevers. Diseases like filariasis can harm the fallopian tubes. Even repeated high fevers, like those from malaria, can cause problems with pregnancy. 7. General health. Just like men, women need good nutrition, rest, and general wellness to be fertile. Chronic illness or severe stress can make it harder to get pregnant. Infertility, myths, and facts. Know the truth. Let's now talk about infertility and the many myths surrounding it. Now, when a couple hasn't had a baby after a while, everyone seems to become an expert. Relatives, neighbors, even co-workers suddenly have advice. You've probably heard things like, "She waited too long. It must be the woman's fault." Maybe you're doing something wrong. But how much of what we hear is really true? Let's set the record straight. With facts, not rumors. With love, not blame. Is getting pregnant easy? Some people think getting pregnant is always quick and easy. Yes, many couples do get pregnant naturally, without trying too hard. But guess what? 1 in every 10 couples today struggles with infertility. That means you probably know someone who has gone through it, maybe even in your own family. So if it's taking time, you're not alone. And it doesn't mean something is wrong with you as a person. It's just a medical condition, and it can happen to anyone. Is it always the woman's fault? Now this one really needs to be cleared up. In many places, people quickly blame the woman if a baby doesn't come. But here's the fact. About 35% of infertility cases are due to problems in the woman. Another 35% are because of problems in the man. And around 20% involve both partners. The remaining 10%, we just don't know. Even doctors can't always explain it. So let's stop pointing fingers. It's a shared journey. A couple's challenge, not one person's fault. Does age matter? Now let's talk about age. You may have seen celebrities in their 40s or even 50s having babies and smiling on magazine covers. But here's the truth. Most of them didn't use their own eggs. Some used donated eggs or embryos. Some even used surrogates. The natural ability to get pregnant goes down with age, especially after 35. And after 40, it becomes much harder. Also, there are more risks for both the mother and the baby when the woman is older. So yes, age matters. If you're thinking about having a baby later in life, it's good to get medical advice early. Does nutrition affect fertility? Absolutely yes. A woman who is too thin or very overweight may find it harder to conceive. Same goes for men. Their sperm quality can be affected by poor diet and lifestyle. Eating balanced meals, staying active, and avoiding too much alcohol or tobacco can really help both partners. Birth control pills. Do they affect future fertility? Many women worry, if I take birth control pills, will I have trouble getting pregnant later? Good question. Here's the fact. No, birth control pills do not cause long-term fertility problems. Sometimes your period may take a month or 2 to come back to normal after stopping the pill. But that's usually because of an issue that was already there. So don't be afraid of using birth control for family planning. It's safe and reversible. To conceive quickly, should we try every day? Now this is a common one. People think, the more we try, the faster it'll happen. But actually, it's better to time things properly than to rush or stress about it. Here's what helps. A woman usually ovulates about 14 days before her next period. That is the best time to try, and it helps to have sex every other day, starting 2 to 3 days before ovulation. Trying too often, like multiple times every day, can actually lower the man's sperm count. So don't turn this into a chore. It should be loving, not stressful. Does stress affect fertility? We all know stress affects our bodies. It can cause headaches, sleepless nights, and yes, it can even affect fertility. But here's the tricky part. You don't need to be completely stress-free to conceive. Women around the world still get pregnant in wars, poverty, and very hard conditions. So yes, try to relax, take care of your mind, but don't blame yourself if you're feeling stressed. You're human. Maybe you're just doing something wrong. Oh, how many couples have heard this? People may say, maybe you're not doing it right. But let's be clear, infertility is a medical issue, not a sexual mistake. It has nothing to do with technique or desire. And there's nothing wrong with how you love your partner. Don't let anyone make you feel ashamed. Hope and healing. My dear friend, the good news is, many causes of infertility can be treated. So now that we've cleared up the myths, let us talk about what you can do. But treatment starts with understanding and support, not blame. Here are some simple steps that can help. Both partners should get checked by a doctor, not just the woman. Start trying earlier if possible, especially before age 35. Eat healthy, stay active, and avoid smoking or too much alcohol. Try to understand your ovulation cycle and time things accordingly. Manage stress. Take time to relax. Talk to a trained doctor or fertility specialist. Early treatment of infections can prevent infertility later. And most importantly, stay kind to each other. Infertility can feel heavy, but love, patience, and teamwork make a big difference. Let's quickly remind ourselves of the facts. Infertility affects 1 in 10 couples. It's common. It's not always the woman's fault. Men are equally affected. Age, health, and timing matter more than rumors. Stress and myths don't help, but understanding and support do. It's not a reason for shame or divorce. Infertility is not a punishment. Help is available. But we must talk openly, support each other, and seek care together. So, my friend, if you or someone you love is facing this, don't suffer in silence. Get help. Ask questions. Support one another. And always remember, having a baby is a blessing, but it's not the only measure of a meaningful life or a successful marriage. In some cases, if pregnancy is not possible, there are still many ways to live a full and meaningful life. Some couples adopt. Others find peace in mentoring children around them. Every family is different, and every life still has value. You are worthy, you are valuable, and you are not alone. Let's build families on love, not just on children. So next time you hear someone blaming a woman for not having children, speak up. Remind them, fertility is not just about the woman. Let's end the silence around infertility and replace it with kindness. Let's replace myths with knowledge and judgment with compassion. Thank you for spending this time with me. If this talk has touched you or helped you understand something new, share it with someone else. Until next time, take care of yourself and each other.